Good morning, ladies and gentlemen. Thank you very much for joining us and welcome to YouGov's COVID-19 update for mainland Europe. My name is Will Alstein and I'm delighted to be joined today by Bianca Brun, who is our CEO for mainland Europe, and Sarah Jones from the Institute of Global Health Innovation at Imperial College. More on our guests later. But before I go a little bit further, I would like just to do a little bit of housekeeping, if I may. There is a chat function on this Zoom software. Please, if you do have any questions as we go along, enter them in the chat. We'll be able to see them. We'll read them all. We'll come back to them at the end. Just to make you aware, this webinar is being recorded. And that is so that we can share it with a wider audience afterwards. And copies of the slides will be available to all after this session. We'll try and get them out. It'll probably be tomorrow by the time that you receive them. But let's crack on. Let me talk a little bit about what you're going to hear today over the next 45 minutes or so. I'm going to open the session and talk a little bit about what YouGov is doing at the moment and why we are doing that. I'm then going to go over to our experts, really. Many of you, I'm sure, who are clients will know Bianca, who leads our team across mainland Europe. Bianca, just let you jump in and introduce yourself.
Yeah, thanks, Will, and hello everyone, and thank you very much for joining us today. So my name is Bianca Brun, and I'm YouGov's regional CEO for mainland Europe, and I am very pleased to be able to provide you with insights and data today that will hopefully support you and your businesses during this very unusual and uncertain time. So thanks.
Thank you, Bianca. And we're really excited to also have on with us today Sarah Jones, who is a PhD at the Global Institute for Health Innovation. We have selected Imperial College London as our academic partner, and I'll let Sarah introduce herself and what she will talk about. Sarah.
Hello, can you hear me?
Loud and clear.
Thank you. I'm Sarah Jones. I am at the Institute for Global Health Innovation at Imperial College London. The Institute is led by Lord Aradarzi, the former Health Minister of the United Kingdom, as well as David Nabarro, who is the World Health Organization COVID-19 Special Envoy. And I am collaborating with a number of researchers at Imperial with the very kind assistance and data provided by YouGov in 26 countries around the world to inform the research efforts. Thank you.
Fantastic. Thank you very much, Sarah. So Bianca's going to look into our data, but before that, what we're going to hear from is Sarah bringing some of the background to the science. I'm going to close the session, talk about our next steps and future development, and then we'll come on to your questions at the end. Let me talk a little bit about what YouGov as a business is doing right now and what our priority is. And that our CEO has been absolutely crystal clear on, both externally and internally, and that is about serving the public good. We are making our data available via our website, through media partnerships, with anybody who wants to interrogate it. There is our public data face, and that is so that everybody can have an idea of what is going on. But that's only part of the story. What we're also doing, as Sarah will talk about, is working with Imperial College London and other public health organizations around the world, supplying them with specific data around public health, compliance with government action, in order that they can really make a difference in helping stop the spread of the disease. So if that's our absolute focus, we do though have a commercial offer, and that is absolutely to support our priority. So we are running syndicated and bespoke data solutions for clients that go beyond our public data, but we have priced them incredibly competitively in order that they are not expensive at these times when budgets might be tight, but also that goes towards helping to fund our work that we're doing for public health organizations. Now that is as much of a sell as you are going to hear from me today. What this is about informing you of what we are doing. Let me talk a little bit about our public data that is available on our website. So our web team have created some really great and interesting graphs and tracking data that you can play with on our website. What I've got on screen is just one example, looking at the proportion of the population in each country that we track of people avoiding public places. As you can see, you can turn lines on and off, and that will be updated on a weekly basis as and when data flows into the tool. That public data is available in 26 markets in total. And you can find that public data at yougov.com/free-COVID-19-tracker. If you are a client and a subscriber to YouGov profiles or YouGov brand index, what we have done is enhanced those tools with the data that we are collecting around COVID-19. So you will find new filters and new variables within brand index so that you can look at all of YouGov's rich connected data through the lens of some of those. So if that's what we're doing, let me hand over to the stars of the show. So first of all, I'm going to go to Sarah Jones from the Institute of Global Health Innovation. Sarah.
Thank you very much. I'm Sarah Jones. I'm joining you from central London today. Very early on in this crisis, YouGov reached out to me to ask how they could help researchers, and the result of those discussions is that there is very much a whole company YouGov effort for the public good, which has really outstripped my reasonable expectations. And YouGov is very kindly donating a considerable amount of their time and resources in dozens of countries around the world. From the research community to YouGov, I want to first say thank you very much. Your efforts are of enormous value to researchers and policymakers worldwide. My research area in particular is consumer health behavior and developing ways of impacting people's attitudes and their behaviors through messaging, corporate programs. Now, very briefly, the global cases of COVID-19 passed the 1 million mark last Thursday, the 2nd of April. It took around 100 days from December to reach that huge number, but it has taken only 5 days for that number to grow by 30%. Deaths from COVID-19 related illness are highest in Italy, Spain, France, and in the UK, followed by Iran and New York City. I thought I would take a moment to pick apart for you what is an actual case of COVID-19, because you will be hearing more and more about this in the bottom of this period over the next week or two. Colleagues at The Lancet published a very useful stratification of what constitutes a case of COVID-19. At the top of the pyramid, those meeting the World Health Organization case criteria for severe or critical cases are most likely to be identified in the hospital setting, presenting with atypical viral pneumonia. Many more cases are likely to be symptomatic, with fever, cough, but might not require hospitalization. Cases are being identified through hospital reports, links to international travel, through contact tracing of contacts of confirmed cases. And the bottom of the pyramid represents mild and asymptomatic cases. It is this bottom of the pyramid which is growing more and more each day, and which will be the focus of much scrutiny over the coming weeks. These cases might be identified through contact tracing, and as testing widens via testing for antibodies or genetic material from the virus, there is a growing recognition of the importance of these unreported and untested asymptomatic and mild cases. Now, I'd like to turn for a moment to modeling transmission. Why and how are researchers attempting to model the data and project the cases? Modeling frequently starts with understanding the biological mechanisms of how a virus attaches and reproduces, and the environmental ways in which the virus gets around, such as through sneezes, touching surfaces, touching your face. Modeling the spread of the virus is actually not limited to projecting the number of people who will become ill. In fact, modeling the spread is primarily done with a purpose in mind, and that purpose very frequently is, what should we do about it? And what I mean by that is that modeling is also for capacity planning for health systems, such as building temporary field hospitals, or capacity planning for manufacturing of ventilators, masks, other personal protective equipment, or PPE that health workers need. Modeling will also hopefully tell us soon what anti-transmission policies and behaviors in individuals are most effective, and I'll come back to that in a moment. Focusing on what these anti-transmission behaviors are, a vaccine may still be 17 to 18 months away from global distribution, and that's according to my latest conversation about a week ago with the World Health Organization COVID-19 envoy, David Navarro. Many of us are home now because of these policies and interventions being enacted to halt transmission. Wide-scale physical and social distancing has the aim of rapidly suppressing transmission to minimize the number of near-term cases and deaths. Colleagues at Imperial note that monitoring the population to test and isolate all identified cases and their household members as rapidly as possible will help reduce transmission. So which countries are doing what at the moment? When we look at the Oxford University Policy Tracking Stringency Index, which you see in front of you, we can see that countries in the world begin to darken with each successive cumulative step they take with respect to policy and how stringent that policy is. What you're looking at here is what the world looked like by the end of January. When we flip to February, you'll see more countries adopting policy and more stringent policy. Flipping ahead to the end of March, we see the countries darken more and more. The color is how stringent the policy is, but not how effective the policy is. So what is the most effective? If we look to anti-transmission behaviors, policies, interventions, researchers at Imperial have produced this estimate of how each policy could on its own broadly affect transmission rates. You can see clearly here that lockdown is modeled to have the greatest effect. However, you can also see that it's not yet possible to know which other anti-transmission policies have clear superiority over others. This may be because in the European countries used to model this, the interventions have taken place so closely together, it remains difficult to understand which interventions have had which impact. I'm involved in research at Imperial College in collaboration with YouGov, Melanie Lees, and Roberto Crespo to look more closely at these anti-transmission policies. There will be many strands of that research and much more to say about that collaboration in the weeks ahead, but modeling people's actual anti-transmission behavior with the help of YouGov data, instead of modeling only with theoretical behavior, may help to extend scientific understanding about how to use the existing transmission models. The hope is there that over time we will understand better which anti-transmission behaviors are most effective as well as the ones which potentially could be relaxed over time. And this kind of information is really needed as the virus continues to spread to new countries around the globe. Transmission modeling heavily relies on the number of contacts that one has inside and outside the household. And I've asked YouGov to provide us with data on the number of people reporting physical contact with others outside their household. Now, these figures have not been released to the public and have not been tested for statistically significant differences. But I can tell you that on my initial inspection this morning of the raw data about how many people, how many citizens are coming into contact with others from outside their own home, there does appear to be a very substantial difference in how citizens from, for example, Germany have reacted to public health policies and how citizens from Spain, Italy, and France are reacting. According to the World Health Organization, testing and early contact tracing is key, and now there is a presumption among researchers that many people carry the virus but don't show symptoms. And those are the people at the bottom of that case stratification pyramid on my first slide. Now, since the beginning of this pandemic, researchers have sounded the alarm that without widespread testing, every country is to some degree flying blind. So what drives people to comply or not comply with public health directives? Are they complying? Will they continue to do so if restrictions continue? There are many ways of attempting to answer that question, and one place to start is by looking at some of the evidence about what is known to drive people's health behaviors. The health belief model of health behavior, which is pictured here, suggests that key drivers of a positive health behavior, such as stay home, include a person's perception about the severity of COVID-19 illness, a person's perception of their own susceptibility to the illness, what they perceive of as the barriers and the benefits of staying home. Factors also include a person's general health motivations and the cues from their body or environment about what they receive about the illness, such as symptoms, a dry cough, public health campaigns such as stay home and save lives, and even other cues such as ambulance sirens. Now, forecasting what happens next is very difficult, and paramount to all of your businesses is, of course, the health and welfare of your employees, your supply chain, and your customers. And you are all in the historically unique and very unenviable position of needing to forecast while taking into account uncertainties that have not previously been relevant to the realm of brands. Factors such as what policies are in place that affect your business, when they are likely to be lifted, how healthy your employees are, your supply chain, your customers. Some of these constraints are well out of your hands. Stores and factories are shut. People are home or will be home soon. People are nervous and many are falling ill. Credit is not loosening up in the banking system quickly enough to ensure supply chains can restart. And I've been asked many times over the past weeks how I would account for COVID-19 when forecasting global business. From where I sit, I know that you are all doing everything you can to keep employees employed and to keep them healthy. To the extent that you're able to, you should include in your forecast model data that you are already, no doubt, collecting, such as monitoring your customers with usage and attitude data, customer intention data, to decrease uncertainty about rising and falling consumer trends. However, to decrease further the uncertainty, you should also consider modeling how the change in the virus transmission rates and the eventual decreases in daily cases in your market can predict the changes in your local policy, such as stores being opened again and large public events being allowed. You should consider these factors in your top-down and your bottom-up projections to decrease uncertainty wherever possible. You should aim to do this in a market-by-market fashion, and you should combine these factors in a risk-based scenario. And I'll hand over with this. It has never been more paramount that companies collaborate, share information, share new business models, new financing models, and new supply chain fixes. I urge each of you to collaborate within and between industries. And please stay home to save lives.
Fantastic. Thank you so much, Sarah. That was absolutely fascinating to get an insight into how the scientists are viewing this, looking at the case stratification, asymptomatic cases, and get an early peek at the what the YouGov data is saying with regards to public contact. Moving on, let's bring Bianca in here. Bianca and her team have been looking across the data that we're tracking in Europe, and is going to share some key learnings for us right now. Bianca.
Yes, thank you very much, Will, and thanks, Sarah. And let's dive into the European data with this first slide, just a very quick methodology note. So we've collected data every week since March 12, and as you can see here, we are collecting the data in weekly waves with 2,000 interviews every week in Germany and the UK, respectively, and 250 interviews per country for all the Nordic countries every week, and 1,000 interviews per week for the rest of the countries. Now, as you can also see here, we will today present you with data from these 3 waves. First wave of the data collection ran from March 12 to 18, next wave March 19 to 23, and third wave from 27 to 30. And as you can guess, we just closed our data collection for the 4th wave last night, and that data will be available and analyzed pretty much as we speak, and probably by tomorrow. So let's dive into the slides here. So first of all, across Europe, we've seen our national leaders appeal to very different emotions, ranging from personal responsibility and solidarity, national pathos, and martial war calls. And we won't, on this call at least, aim to answer what communication strategy has worked the best, but our data certainly highlights that some strategies seem to have been more successful than others. And for everyone on this call, whether you are a leader in your organization or you're advising your own organization or your customers on how to best communicate, the data will provide you with a great sense of what state of mind your target audiences are in these days, and will support you in carefully considering how to address your audience with potential messaging. And on this specific slide here, you see the difference in the messaging around COVID-19 from our leaders in Italy, France, and Germany. And especially France stand out with Macron's clear messaging around France being at war, Corona being the enemy, and the general mobilization is required. And both the Italian Prime Minister and Bundeskanzlerin Merkel have appealed to solidarity and responsibility. But Merkel wasn't particularly visible in the beginning of the crisis, which is also evident in our data. But since she actually self-quarantined, and has she been communicating very actively, and that has indeed had a positive effect on the data that you're about to see. She's obviously now returned to office and is no longer in quarantine. The next slide here gives you another 3 examples of messaging and appeals from our European leaders, the UK, Sweden, and Denmark, where particularly Sweden stands out with a different and somewhat, and certainly seen by some countries, controversial hands-off approach in relation to tackling COVID-19. However, both Stefan Löfven and Mette Frederiksen have appealed to solidarity and responsibility, and they've stayed away from war-related language. Boris Johnson had a light touch of this language in his messaging, even if he's certainly also appealing very much to solidarity. And we're certainly all thinking of him these days, where he's, as we all know, in intensive care because of the virus. Now, let's look at the data from the last 3 weeks and see how the general population in the different countries are responding to the leaders' messaging. So we'll look at our trust in the system and the sense of threat from COVID-19. So this first slide talks about the level of fear. So I will spend a little bit of time just explaining the graphs, because the coming charts will kind of help with the same coloring, etc. So on the horizontal axis here, you see the dates for the 3 waves of the data collection. And the lines show the percentages of people saying that they are very or fairly scared of contracting the coronavirus. And just to give you the colors here, because for the colors for the different countries, we'll be using this coloring for the coming slides. So we have Denmark in light pink, placed in the middle of this chart, and Finland in the light purple, France in the dark purple, and is the one country increasing the most, with actually 70% of the French people during the last week's data collection saying that they are very or fairly scared of contracting the virus. Germany you'll find in the dark green, Italy in the red at the top of the chart, by far with the highest level of fear, Norway in the light blue, Spain in the blue line, moving continuously up over the 3-week period. Sweden in the black at the bottom of the chart with the lowest level of fear and more or less constant throughout the 3 waves. And finally, you have the UK in dark pink, which after France is the country with the highest increase in people saying that they are very or fairly scared. Now, I won't go through each line on the following slides, but I hope this initial examination will help make it easier to read the following slides. But on this slide, the key takeaways is really that we've seen the most significant increase in the level of fear in France and the UK the past 3 weeks, and a continuously calm situation in Sweden. So on the next slide, we're looking at satisfaction with the government across the region. And here I must admit that we have doubled and triple checked the data every week to ensure that the data from Denmark has been correct, as the satisfaction has been continuously and somewhat overwhelmingly high, as you can see. But they are correct. Italy has also got a very high satisfaction with the government, where we find the lowest satisfaction here in Spain and in France. France with a significant drop in satisfaction from the initial 2 waves to the last wave, where satisfaction has dropped to the lowest point of all the European countries. The biggest increase is in Germany over the 3 waves, which is expected to be linked closely to the increased visibility of Merkel throughout the period. The more visibility and communication from the leader, the more satisfaction, which is, of course, also a key message to all leaders in the current situation, not just our government leaders, but indeed also company leaders in general. The next slide talks about confidence in the healthcare system, where Italy and Spain remain very confident in their healthcare systems. Now, this may be less about confidence in the system as such, and more about confidence in the amazing and brave healthcare workers that we have. And we see, of course, this unique support with standing ovations for the city's healthcare workers from balconies in Madrid and Barcelona every evening during this period. The biggest increase from wave 1, from the first wave to the 3rd wave, is in Norway and Sweden. Despite 2 very different strategies from the government, both countries have experienced an increase in confidence in the healthcare system and their ability to cope with the situation. But it is noteworthy that Sweden came from the absolute lowest confidence level in mid-March. At this time, the Swedes were clearly worried about the overall strategy applied by the government. However, as their satisfaction with the government has increased, so has their confidence in the healthcare system. And France has the lowest confidence level in the healthcare system, and the development over the past 3 weeks for the confidence level follows the development line for the satisfaction with the government. And these 2 areas are much more connected for the French than for Spain, for instance. The next slide, we have used the latest data, so wave 3 data, to look at the relation between the level of fear and the trust in the system. And as you can see here, the level of fear in France is almost as high as in Italy, but the trust in the system in France is the lowest of all countries. And this does highlight some obvious questions related to messaging about being at war, and it certainly is important to be mindful of this situation in France and the level of frustration in France if you are communicating to a French audience. Spain provides evidence that low satisfaction with the government does not automatically mean low confidence in the healthcare system. Probably, as I said earlier, because they have confidence in the healthcare workers more than the healthcare system per se. And finally, the calm way of dealing with the situation in Sweden makes the Swedes feel very safe, but it does not automatically translate into satisfaction with the government or a high confidence in the in the healthcare system, as you can see. Now we change pace a little bit here in terms of now we want to look at the consumer behavior during the lockdown. So the first slide we will be looking at here is actually not a very surprising slide, because we see high percentages of people saying that they are spending less in physical stores these days, especially in Spain and France. We see a high percentage of people spending less. Only a small percentage of people across the region say they're spending more in physical stores. Now in Italy, we have the highest percentage of people that say they're spending more in physical stores these days, which could very well be linked to the fact that we also have the highest percentage of Italians that say that they are more often than usual preparing home-cooked meals these days. Now, the obvious question when you look at this slide is, do we spend more online these days? So looking at the next slide, actually the answer is that also our online spend is negatively impacted by the current situation. So not as many people say that they are spending less online as we saw before with less spend in physical stores, but still we see a relatively high percentage of people saying that they are spending less. Some are spending more online these days, and this more spent is predominantly on groceries. Next slide, we look at the home cooking situation. Preparing food at home is the new normal for most of us, and especially in Italy and Spain, we see a very high percentage of people who are more often than usual preparing food at home. And this is particularly challenging for some people, and certainly for people like myself and my family, particularly my 9-year-old daughter, as neither my husband nor I are able to cook. So the obvious question here is then, do we take advantage of ordering more food for delivery these days? So we look at the next slide, which talks about food delivery, and the answer is that some does, but again, we see a higher percentage of people saying that they use food delivery services less often these days. So the general uncertainty is again impacting spend and potentially also the fear of getting infected. So the final slide from my side provides an overview of our behavior as it relates to TV and on-demand entertainment consumption these days. And where the situation has been particularly severe, like in Italy and Spain, we see a very high percentage of people saying that they are watching more TV and more on-demand entertainment than usual. And as you can see, this is a general trend across the region. Now, Will alluded to this earlier in our presentation, that we have our connected data where we are able to dive much deeper into the data that we've presented here, and we can look at exact changes by different audiences, etc. And we will of course also have the data from our last wave ready by tomorrow. So please don't hesitate to reach out to us for more information and deep dives, etc. on this data, and we're very, very happy to help you and hope we can help you in your organization. So with that, I am turning back to you, Will.
Fantastic. Thank you very much, Bianca. Really interesting to see what the picture looks like across Europe. Different levels of response and satisfaction to leadership across those different styles. Just a reminder to everyone, if you would like to ask a question, please do write them in the chat function of this Zoom application. Your questions will be asked completely anonymously. We promise not to read out your name unless you really want us to, and we'll come back to those at the end. What I just wanted to talk about was looking at some of the other data that we're collecting, and do a sort of slightly give a slightly different view and step away from our COVID-19 trackers and look at some of the other data sets that YouGov creates and curates for our clients. So I'm going to look into some UK and some US data. In the UK, what we do is we track consumer confidence This is in association with the Centre for Economic and Business Research. And the data is released at the end of every month based on a sample of around 5,000 consumers. The data that I'm showing you here is for March. And what we can see is there has been the biggest fall in UK consumer confidence since the Brexit vote in the summer of 2016. Previous to that, the biggest fall was actually going all the way back to 2008 and the collapse of Lehman Brothers and the credit crunch. But that overall index is made up of 8 measures. It looks at sort of 4 themes, if you like, looking at household finances, the value of someone's property, job security, and business activity. And as you can see on the chart on the right, every single one of those, bar one, is down. People feel as though they are in a worse financial situation compared to the last month. They can't see that improving over the next 12 months. Their property value is down now and will be in 12 months' time. They feel less secure in their job now, and there is less business activity going on, not only now, but they're also projecting that into the next 12 months. Not a great picture in the UK, and with the Prime Minister admitted to intensive care last night, I can only imagine what is happening to consumer confidence as we speak, because data collection from April is underway. Switch tack, and let's travel across the Atlantic to the US. And there we track a very interesting audience, and it is affluent US consumers. Some might say, along with the elites in China, this is a tremendously important group, especially for European luxury brands to sell into. And again, we track this audience every single month. And what I'm displaying here is 2 particular questions. And that is, how confident do people feel with regards to the following, with regard to the coronavirus outbreak? And what we are looking at is proportions of people who are extremely or very confident in, on the left, the US economy, and on the right, their own personal economy. You can see that we have polled this group 4 times since the middle of February. And there has been a decline not only in their confidence in the US economy, but crucially in their personal economy. The latter, much of it linked to not only their investment portfolio, but also their personal pension pots, as the Dow has seen about 7,000 points wiped off it, and the NASDAQ taken about 1/5 of its value. Note, however, that these figures were collected prior to the $2 trillion stimulus package that was announced in the US. We've got data collection going on, and I'll be very interested to see how, if at all, that stimulus package has impacted these results. Bianca referenced earlier some of the category data that we look at. So when we look at people who are in market to buy in a particular category over a certain period of time. Now, this data is taken from our brand index tracker. And I've pulled out 4 sectors that we think are particularly interesting. And the questions that we ask is, how likely are you to spend in that given category? And we vary the length of that spend window based on the category. So for example, when we're talking about flights, hotels, and cruises, because people buy them infrequently, they're relatively big purchases and they plan ahead, the window that we ask about is over the next 12 months. For more everyday purchases like health and beauty products, we look at a window over the next 30 days, and clothing, we look at over the next 3 months. And what I'm showing is looking over the a 5-week period up to the end of last week. And it's a worrying picture and trend. Flights, hotels, and cruises, we would necessarily expect people to be cancelling these or delaying them. Certainly over the next, well, the immediate future because they're unable to travel, but certainly over the next 3 to 6 months because of uncertainty about whether those events might or might not be able to take place. But I think the worrying thing for airlines and hotel groups and cruise liners right now is the proportion of people saying that they are coming out of market over the next 12 months to purchase in categories. Health and beauty, we've also seen a steady decline of. From about 9% of people coming out of market compared to the same week last year. And clothing, rather surprisingly, in our final week, down by 24 percentage points compared to the same week last year. So it's really interesting to look at that spend data, and we could look at that across 37 sectors in the UK, and even at particular brand level. But brand index, of course, available in about 41 markets these days with similar data. I think what's also interesting, Bianca talked about it at the top of the presentation, but was thinking about messaging and leadership. And what we've seen, again, is that companies that are putting out the right message at the right time with regards to the coronavirus, the public responds well to them. And we've got some examples here. Again, I've used UK companies that are putting out the right message at the right time. For those of you familiar with Brewdog, an independent brewery based in Scotland, they have made a very public announcement about turning their distillery to mobilize their assets to produce hand sanitizer. And we're working with the National Health Service in Scotland to deliver vast quantities to support the local NHS hospitals. As it turns out, the first batch hasn't met clinical standards, but they are working in a very collaborative way to try and adopt the formula so that it can be used in a clinical setting. Now, ever since that news story broke, along with the fact that the senior management were going to take a pay cut, that they were going to look after their staff, we've seen their reputation score steadily increase over the course of March. And it's gone from a score of 15 to a score of 21 over that period. Now, Brewdog isn't the only one. There are a number of other organizations, such as Marks & Spencer, who teamed up with Deliveroo to look at ways of increasing home delivery services via a contactless system, so dropping your goods at the door. Morrison's has also come out very publicly, a very large supermarket chain in the UK, to donate £10 million worth of food to food banks. And again, that has pushed up their buzz score over the course of March. So you can see that getting the right message out at the right time and the public perception of the brand responds very well. But get the message wrong, and we can see that it has a very poor impact on the brand. And I've picked out two examples here. Sports Direct, a sporting equipment and clothing retailer. Got a large high street presence, and when it was announced in the UK that a lockdown was coming, that all non-essential businesses should close, Mike Ashley, the CEO, made a very public announcement that his stores would remain open because he considered them to be essential, and made the argument based on the grounds of people need to exercise, people therefore need to come and buy sporting equipment. In fact, YouGov did a poll on that, and 88% of the population believed that Sports Direct was not selling essential goods, and it took about 48 hours before the company reversed their policy. But in that time period, their buzz score sank by 35 points. Weatherspoons, a very large pub chain, also made similar noises. In that they were going to keep their pubs open, although they're going to try and practice social distancing. And again, they weren't treating staff particularly well in that instance. And again, they've seen their buzz score sink, which just goes to show that brands need to get the message out there at the right time to the right people saying the right thing. What will be interesting is to see who jumps on the bandwagon, and do we get any, in the same way that a company would create greenwash, do we get any COVID-19 wash? You know, people putting out a bland, ineffectual message that really doesn't resonate or work for the brand. And it will be interesting to see how those stories develop over time. But that's enough of me talking. I'll briefly touch on what we're up to next, and then I'm going to come to Bianca, who's been looking at the questions that have been coming in. So in terms of our tracking suite, we are expanding it. So the COVID-19 public tracker, that has been running certainly in APAC since February, and will continue to run for as long as is required. Our health compliance monitor is the data that we are delivering to Imperial College London, and is the data that Sarah was referencing earlier in the presentation. There will be some elements of that that will also be incorporated into our public data, but watch this space on that. The consumer tracker that Bianca was talking about and all these rich insights came from is live. That will continue to develop, but we're slightly changing the survey in that, for example, when we first started tracking this, we asked about people's awareness of COVID-19 or coronavirus. That was a legitimate question to ask back in the middle of February, when this was very much viewed by some people in the West as something that's going on the other side of the world. Now that that awareness is up to 100% or thereabouts, that is a redundant question. So we're removing things like that and updating the question set. Also launching this week, we're looking at an economic recovery monitor. So that will look at essentially two things. It will look at people's current financial situation, people's perception of their future financial situation, so we can get an understanding of what the recovery looks like when it comes, whether that will be a U or a V shape, and what the future consumer is likely to look like on the other side of this. There is anecdotal evidence that we're hearing in a number of markets to say there is a fundamental change in the way that consumers think and are likely to behave. To give you an example of that, many people have been forced to work from home who have not previously worked from home. Do they like it? Some may well do. Some may well get an improved work-life balance with the lack of commuting. Companies may change their view of employees working from home and find them more flexible. The ramifications of that are significant, not only for employees who've got more time to either be more productive or to spend it with their family, for planning in terms of transport, of capacity for getting people to and from city centres for work, but also for those that own office space in city centres. Are they going to see lower demand in the future? So that is coming out. That is that economic recovery tracker is being launched this week, towards the end of this week, and we're hoping to roll that out as quickly as we can to all markets where we're tracking. And there is also sector monitors that are under construction, so that's looking at deeper dives into specific business verticals. So that's enough from me. If you are interested and want to learn out more, whether that be as a client, learning about how you can better use the data within brand index and profiles, or you want to look at something in particular, please do pick up the phone or email your account manager, or there is a general info@yougov.com email that you can use. So, over the last 7 minutes or so, I'd like to go to questions. Bianca,
Yes.
what, if anything, have you seen from the questions that you think's worth?
Yes, so actually just picking up on your last point, Will, about sector monitor, because we've got some questions to do with sectors and deep dives into sectors such as travel, etc. You were actually just touching on the travel part, just as that question came through around travel. But yes, we are looking at the sector monitors. We'll dive into those things, and certainly also what Will was saying, the economic recovery monitor, where we really look at the future consumption and the new normal potentially as we recover. I also saw a question, somebody was asking whether we have data on satisfaction with the US government compared to European countries, and also the US trust in the healthcare system, etc. And we do have that, and we have it for all those 26 countries that Will listed in the beginning of this presentation. So we're tracking the same things across all these 26 markets. Also, several questions coming about whether the presentation will be available, and I know we're trying to answer those right here, and yes, indeed, will be made available, also the recording, so you will get that. So those were sort of some of the ones, Will, that I sort of picked up. I don't know if you have picked up on some other things that you want to highlight.
Sure, thank you very much. There was one at the top there of, do you have any data on travel mindsets or how people think they will react once confinement is over? That's a really, really interesting question. Let me break that down, if I may. We do in some countries have something around mindset. I'll give you an example. It's actually a chart I was presenting the other day, looking at the mood of the general public. And what we do is we track a number of mindsets, if you like, so whether people are happy, frustrated, stressed, etc. The one that, and apologies for being UK centric here, but the one that sticks in my mind is that the UK happiness index has fallen from about 46 to about 26 percentage points. And the top two ways that people would describe themselves in the UK currently are stressed and frustrated. So that's on mindset. On travel, this is a really interesting one. Is how do people feel about travel? And that's one thing that we are keen to explore further. Will we see a lot more staycation for the remainder of 2020. One thing that I know a lot of businesses are looking at is what is their potential holiday liability once confinement is over. Employees perhaps not taking holiday while they are on lockdown, and then they've got almost a whole year's worth of holiday balance to take once lockdown is over. How will companies deal with that? But more to the point, where are people going to go? Will they remain in their local area? Will it be a case of I just want to jump on a flight and disappear from this and escape? We're going to start certainly asking questions around that and what it's like when confinement is over. So really interesting question there. Bianca, is there anything else that that you've seen coming through on the questions?
Yes, we do have one here. Well, just came through. So it's quite surprising regarding satisfaction of government in France. Of course, there are many discussions, but the figure that we have on media is 39% satisfaction, 10%. How can you explain this difference of perception?
So I think on that one, Bianca, it's probably what we can do is we can come back to that one in writing. I would have thought.
Yeah, it's very specific.
Let's go. It's very specific. Let's go away and have a look at the data and make sure that we're answering that. Want to give you a very clear answer to that one rather than try and dig out an answer on the hoof. Okay, well, if that is it for questions, I would like to first of all thank both Bianca and Sarah for their contributions today. Some really interesting insights into the way that scientists approach this and think, and what we're seeing across Europe from our data. But most of all, I'd like to thank all of those of you that are tuning in, both clients and non-clients and partners to today. As we said, we will follow up this with a copy of the slides. And if you do have any further questions, then please do get in contact with us, info@yougov.com, or speak to your local sales rep. Only leaves me to say thank you very much, and I'll leave this to Bianca to say a final few closing remarks and wish you all good afternoon.
Thank you very much, everyone. We're really, really very delighted that you wanted to join us today, and we're looking forward to helping you with any questions or anything that you might have coming out of this or with your business in general. So thank you very much for joining us, and have a lovely Easter, everyone. It's coming up for all of us. So thank you very much. All the best.